Hello, everyone. Just getting some last minute stuff going here. Okay, great. Is that Al? Hey, Al. Good to see you. All right. So everyone, welcome to my webinar. If you have back or sciatic pain, you're in the right place. My name is Rick Olderman. I'm a physical therapist here in Denver, Colorado. And we're going to talk about back and sciatic pain. And so I gave this talk a couple weeks ago, and I think the most popular part about it was the Q&A afterwards. So I've kind of shortened my talk a little bit to allow us to have more time for questions and answers too. All righty. So hopefully we'll get everyone's answers or questions answered. And then a couple of little things. At the bottom of your screen, I'm not sure how many of you are that familiar with Zoom, but if you put your cursor on your Zoom screen, you'll see a little black bar at the bottom. And you might see an area called reactions. And if you see that and click on that, you'll see there's a way for you to raise your hand to ask a question. It says raise my hand. And that's how you're going to ask a question if you have one during the time. If you don't see the reactions button, then go to the more button and click on that, and you might see the reaction button from there. And that's how you're going to raise your hand. And then after you raise your hand, then please lower your hand so other people can raise their hands. So anyway, we're going to use that kind of system to ask questions, because I think everyone is muted right now. And that's the only way that we can see that someone has a question. Okay, and then let's see, the other thing I wanted to say is if you stick around until the end of my little talk here, I'll show you how to get a free DVD from me, so for back and sciatic pain. So stick around. I'm going to make it go through everything as quickly but as thoroughly as possible so you really understand where I'm coming from with solving back and sciatic pain. Okay, so let's go ahead and get started. It's now a minute or two after 6. Everyone should be here. So let's see. Okay, so what we're going to learn today there's 3 secrets to solving most back and sciatic pain. The first one is that there are 2 primary patterns behind back and sciatic pain. And the second is what most practitioners miss when trying to solve back and sciatic pain. In other words, why you still have it and probably why you're watching me right now. And the third secret we're going to cover is how to solve the 7 most common back and sciatic pain diagnoses. All right. So I want to talk a little bit about me. A lot of you probably don't know who I am. I'm a physical therapist. I've been a physical therapist since 1996. I'm also a Hanna somatics practitioner, a Pilates instructor, a personal trainer. I'm certified in therapeutic dry needling, and I've owned my own clinic here in Denver, sports and orthopedic clinic in Denver for about 10 years now. I've also written 6 books, all available on Amazon. They're all bestsellers in each of their categories. And I speak at conferences and so forth. And usually when I speak at a conference, I have the highest attending talks, and it has nothing to do with whether I'm a good speaker or not. It's the fact that I talk about back pain, and then my other talk is about neck pain. And, you know, I just want you to know that you are not alone in having stubborn back and sciatic pain. All of these people in this room have stubborn back and sciatic pain that has not been solved. And so this is why I always speak. I usually speak to standing room only crowds at conferences, because there's so many people just in your shoes. And I think the information you're about to hear from me tonight will help you see why you're in those shoes and hopefully get you out of them. Okay, so let's get down to it. How do I specifically solve back and sciatic pain? Well, this gets into our first secret, that there are 2 primary patterns behind back and sciatic pain. So let's talk about those for a second. I want you to know that this isn't something that I've just come up with out of thin air. This is based on a lot of research. Most of the research by Dr. Shirley Sahrmann, who's a PhD PT out of University of Washington in St. Louis. She's written 2 textbooks, one of which has been translated into 7 languages around the world. And she has probably written hundreds of published research articles about the biomechanics of movement and movement impairment syndromes. And this is basically the thrust of the biomechanics behind how I solve pain. And so Dr. Shirley Sahrmann, she's been a PT for probably 50 years, has come up with the idea that there are 3 basic patterns behind almost all back and sciatic pain. One is an extension problem, another is a flexion problem, and the third is a rotation problem. So what do I mean by an extension problem? That basically means that you have too much arch in your back, or that you have too many forces trying to pull your back into an arch. And we're going to test for this in just a little bit here. And the second pattern is a flexion problem, which means you have too little arch in your back. And that one's really rare. And so I'm not going to really talk about that tonight, because I might see 1 or 2 people a year with that type of pain pattern. And I don't want to waste our time on that one because it's so rare. The third one is a rotation problem. That means if you've ever been to a doctor or PT or chiropractor and they've told you that you've got a rotated pelvis or a rotated L4 on L5, things like that. That's what a rotation problem is that Dr. Sahrmann has identified. Okay, so she's written extensively about this. She's taught these patterns, and initially, when I took all of her seminars, read her textbooks several times, and started implementing her information, I started seeing a really rapid improvement in my patients' back pain and sciatic pain. I suddenly understood really what was going on with them. But as is the case in medicine, as you get better with one level patient, a new level comes knocking on your door. And so once I started feeling comfortable, this new level of patient started making me feel uncomfortable. And so I realized they weren't responding as well as this other group of patients to just the biomechanics of movement and things like that. And that's when I sought out some more information. I stumbled on Thomas Meyer's book called Anatomy Trains, which is about fascia. And it turns out that there are super highways of fascia, and fascia is connective tissue in our body. It holds everything together, muscles to muscles, muscles to bone, blood vessels, tendons, ligaments, nerves, everything. It holds everything in place. And there are these super highways of fascia that are running through the body that link our feet up to the top of our head. And there are 3 primary superhighways of fascia that Thomas Myers identifies. And guess what? They almost identically link with Dr. Shirley Sahrmann's 3 primary biomechanical patterns behind back pain. And so by looking at Thomas Meyer's work, I was able to see things further away from where the pain was felt as a potential culprit in pain. And so once I started exploring those other potential culprits, I started solving this next layer of difficult patient. Well, as it turns out, once I got comfortable with that, another layer of difficulty came knocking on my door. And these people seemed to have some kind of a battery in their bodies that was supercharging their bodies to be locked in a pattern of dysfunction. And I could fix that pattern of dysfunction, but it kept coming back again and again. And I didn't understand what this neurologically based tension seemed to be coming from. And that's when I discovered Dr. Thomas Hanna's work. He has a book called, I think it's just called Somatics, actually. It's a very thin little book, easy read. And I decided to study his information, and I took his course for 3 years. It was extensive, but the very first day that I went, they talked about that there are 3 primary patterns behind almost all pain. And these 3 primary patterns almost identically match Dr. Shirley Sahrmann's 3 primary patterns of biomechanical and movement-based issues. And then also Thomas Meyer's fascia superhighways. And now we've got a third researcher focusing more on our reflex systems and neurologically based generated pain. And they found the same thing. So here's 3 different practitioners unknown to each other in 3 different areas of musculoskeletal study, all finding the 3 common things. The one thing that none of them really went deeply into, though, was why these 3 patterns were happening. why the fascial patterns were happening, why the movement patterns were happening, and why the neurological patterns were happening. And so that's what I've been focusing on, because I've found that if we can understand the why behind pain and solve those whys, then it's really fixed for good. And so I've combined these three approaches with my own little research about why these patterns are happening. And that's kind of what this talk is going to be about, is getting down to the nuts and bolts. Okay, so that's a little background about where all this information came from. All right, so one of the primary patterns of behind most back pain is something called an extension problem. And if you remember, that means that your back has too much arch, or there are too many forces trying to pull it into an arch. And we'll talk about that in just a sec. So there are two postures that relate to this pattern. One is a lordotic posture, and that's the one on the left. And I'm going to kind of reduce my screen so I can use my cursor here. So you can see this big curve in the low back here. And usually that's followed by a big opening of the abdominal cavity. And then the pelvis is typically tilted forward like this. And usually there are tight thigh muscles. And that's what this woman represents. This is her standing normally. She's not trying to stand in any weird way. That's just the way she is. So you can see the big arch in her back, the distended belly, the pelvis is tilted down, and she happened to have very tight thigh muscles. And then the other pattern that falls under extension problems is the sway back posture. And so sway back, if you can think of maybe a mopey teenager kind of person, all right, that's kind of what this posture is. They're in a lot of extension here. There's not really much muscle activity going on at all. The pelvis is actually tilted backward instead of forward, but the whole body is shifted forward so that they can sit back on their spine like this. And so that's the extension. That's the other pattern in extension problems. Okay, I'm going to stay in this screen so I can use my cursor on this one. So the second pattern that is behind most back and sciatic pain is something called a side bending problem. So a side bending problem, I learned this from the HANA somatics. They identify side bending issues, and it's really fascinating, I think. So in this pattern, what you'll see is a pelvis that's higher on one side than the other. And typically, although most people don't measure it, what's happening is that this rib cage is also lower on that same side. So it creates compression on this side of the spine. And you can see that in these images of people. You see that big crease on this side. It doesn't exist on this side. So, and you can see her pelvis is higher on this side and lower on this side. Her rib cage is lower. She's got a left side bending problem. This person also has one. Here's a crease, bigger crease here, then over here. She has a left side, and you can see the pelvis is slightly higher on this side than this side. So you can see that she also has a left side bending problem. The interesting thing, though, is HANA somatics identifies this from this, it's called a withdrawal reflex pattern. But Dr. Shirley Sarman identifies it as a rotation problem. Well, how can we have a side bending problem that's also a rotation problem? Well, when the spine is in a neutral position, for instance, when we're standing, when you have side bending to one side, you have rotation to the opposite direction in neutral spinal mechanics. All right. So but in medicine, in most of the textbooks that I've studied and looked at, and most of the continuing education courses I've gone to, they all talk about a rotated vertebra as the problem. And you might have heard this from your own practitioner, or your doctor, or your chiropractor, or your physical therapist, or someone like that who said, "Oh, you've got rotated vertebrae." Well, I've tried to solve rotated vertebrae, but they don't solve. They don't stay fixed for permanently. So why is that? Well, it turns out that the rotation is a symptom of a problem. The problem is actually the side bending, not the rotation. The rotation is occurring because of the side bending. So once I discovered how to fix and identify and fix a side bending problem, boom, all the rotation problems went away for good, because the battery that was charging that rotation was solved. And I just wanted to show you this to you on this image here. You see how on this side of her spine, these muscles look bigger than this side? They look like, so you might think that she's stronger or has more muscle developed over here. No, that's not the case. What's happening is because of her left side bending problem, her spine has rotated to the right. And that's what you're seeing, is everything pushing against the muscles here. Same on this side. It's not as dramatic, but you can see her muscles are thicker on this side than they are on this side. They're not stronger. They're just more, everything has been rotated into those paraspinal muscles. And so it makes it look like everything's rotated. Well, it is rotated, but the reason it's rotated is because of the side bending problem. Why are we having a side bending problem? Usually because it's a problem in the same side of the leg of the side bending problem. That's usually, sometimes it's a compensation for opposite side issues, but usually it's a same side issue. Okay, so I'm gonna change my screen back again so you guys can have a bigger picture. All right, so we've identified the two patterns of problems causing most back and sciatic pain as identified by these three researchers. And then the second part is you have to know which patterns you have. Well, I've kind of made that easy. Almost everyone, and you're going to figure that out tonight, actually, which two patterns, if you have one or both of these patterns. So you need to know which patterns you have. But the big thing is you have to solve why you're having those patterns of issues. It's not enough to know that you have it. You have to know why. And if you can solve the why, you're going to fix it. This is the key. All right. So just a case in point, this woman actually was a patient of mine. She walked in, I saw her back, and I nearly fainted. I just didn't know what I could possibly do with a back that looked like that. But I just went through my systematic exam that I developed based on all of this information. And in about 7 visits, she was 90% reduced in her pain. Okay. So it really helps when you can see things from a systems standpoint, which is what I'm talking about here, is looking at the whole body as the system that's feeding a problem. When you look at things from this kind of systemic standpoint, it's much easier to solve pain. Steve came in, he had back pain and sciatica. Sciatica was gone in 2 visits, low back pain in about 6 visits. All right. This is not unusual. This is kind of typical of what we see in the clinic. Sometimes it's a little bit longer, sometimes a little bit shorter, but it's all roughly in that because we can move quickly when we understand what the problems are. Carol was a collegiate swimmer who walked in with 15 years of back pain. She was a Division I swimmer, top of the food chain, access to all the best medical services possible, had to leave her college career behind because no one could solve her back pain. 15 years later, she walks into this clinic, not for back pain, but for foot pain. She was having plantar fasciitis. I couldn't even touch her back. She had completely given up on her back, even though, I mean, just to watch her move, she would have to, if I had her stand up from sitting, she would have to brace herself and breathe through her pain and for about 30 seconds or a minute before she could do anything else. She was in so much pain. I didn't even touch her. And in 1 visit, she was 75% better. Not only the back pain, but also the plantar fasciitis. And so this is part of where the Thomas Myers information comes in, is that because I see things as a system, when giving simple solutions can have comprehensive ripple effects in the body. And that's what happened with her too. I was surprised. I did not expect that to happen, but she was a completely different person the next time she came into the clinic. She actually smiled. So if you've been struggling, this is probably why, which gets into our second secret, what most practitioners miss when trying to solve back and sciatic pain. All right. So what most practitioners are looking at the body, I call it a component. It's a component thinking. So you may have been to a practitioner who looks at your pelvis and says, oh, you've got an upslip or a downslip or a nutated or counter-nutated or rotated this or that or whatever. Or maybe they're looking at your spine and saying, oh, you've got a rotated L4 on L5, or you've got this and that, and all of these little things happening with your spine. And so they go about fixing those things, and that might help temporarily, but you have to keep coming back again and again. And it's because they're looking at just things through this little magnifying glass and fixing the things that they're seeing wrong, rather than fixing the system that's creating those problems to occur. All right. So that's how most practitioners are looking at things. And they might look 1 or 2 joints away, but they're not really looking at for instance, how the foot is affecting the back. They might know that the foot affects the back, but they don't know exactly how to link that whole system. It's kind of like a Rube Goldberg device, where you can put a little ball in a cup at one end of the room and all of these machinations happen, and across the other room, Christmas lights light up. And what I've been doing in the last 20 years is looking at all of these connections through this whole Rube Goldberg device that is our human body, and figuring out what these connections are. And so that's why it's so easy it's just simple to look at this body as a system. And all of my therapists have been trained the same way, and they can see it the same way very rapidly once they're shown what these connections are. So this is how most practitioners see the spine. This is pretty much how I see the spine. All right. We look at how you're bending over, how you're walking, how you're moving, everything, because everything matters. And I'm going to prove it to you right now. So let's all stand up. And so stand up with me, because you're spending time with me right now, and I want you to feel what I'm talking about rather than just hear the words. So what I'd like you to do is you're going to put your hand on your low back like this, the palm on the back. And I want to make sure that your fingers and palms span the whole width of your back there. And all you're going to do simply, and if you have bad balance, have a chair nearby or something. But I just want you to lift one leg and feel what happens to the muscles in your back. You'll feel something change. You might not know exactly what's happening, but you can feel something's happening. Then switch legs, right? And feel that something has changed again, and keep going back and forth. And you're going to feel that your back muscles are changing from one leg to the other. Can everyone feel that? I hope you can, because your back is responding, and this is walking basically. All right. So if your practitioners haven't been using walking as a method to solve your back pain, this is probably why your back pain isn't solved. It's a huge, it just affects the back in a huge way. So let's do another one. If you just raise that arm up, that's not holding your back, and then bring it back down, you will also feel your back muscles change. All right. So this is proving that what you do with your body affects your back. And this is not how most medicine is approaching injuries, or at least chronic injuries in the body. So what we're trained, this is not how I was trained in school. It's not how, and judging by all the physical therapists I've trained at my clinic, it's not how they're being trained either. And what's happening is we're trained in medicine to say, oh, you've got shoulder pain. Let me fix that shoulder. Let me treat that rotator cuff or that biceps or whatever that is. Let's treat that. But we're not looking at the whole system to understand why that shoulder is hurting. We're just making it feel better. Same with back or sciatic pain or whatever. Name your area in your body. We're not understanding the whys behind the pain. And that's what this whole systems approach understands instantly, with the whys behind all of the pain. Okay, so that's our little test. Hopefully you felt what was going on in your back there. All right, so the benefits of a system solution is that you get rapid results, and we fix everything, because we're looking at everything, and we have to fix everything in order to take all the stresses off your back. So it makes sense. But the best part is, this is the part that I love, is that the patient is in control, because I can't fix your body. You're the one who has to fix your body, because you're the one who's using it, right? So how you're using that body has a lot to do with why you're having pain. That just makes intuitive sense. So doesn't it make sense that you should have to learn how to solve it yourself too? So when we treat patients at our clinic, almost no one comes back for the same problem again, because they understand A, why it's happening, but B, how to solve it. And I actually have people at the end of their sessions, I said, look, in 6 months or a year or 2 years, this pain might come back again, because this is an old habit that you have. I want you to write down the 3 exercises that have solved this, so that when this happens again, you're going to go back to these 3 exercises. This is the thing that's going to, and then you can do these and it'll be done. So that's putting you in control so that you're not at the mercy. I mean, yeah, you may have a great practitioner who's solving your pain from week to week, but what if they retire, or what if they move away or have an accident or something like that? So, I don't like to be reliant on other people. So, I want to be in control of my body. So that's the beauty of this system. And because of that, reduced reoccurrence, because the patient understands why they're having pain and how to solve it. All right. Can anyone do this? All right. So I'm just going to bring this up. I mentioned that I have some books available on Amazon. Here, these are 3 little test reviews written about my book, my back pain book. And I'm going to have to lower that down because there we go. I have been suffering from sciatica off and on for the last year. I have seen an orthopedic surgeon, physical therapist, massage therapist, chiropractor, and acupuncturist with only short-term relief. The exercises in this book are the first to actually correct my bad movement habits and provide sustained release. Thank you so much, Mr. Olderman. Oh, sorry about that. Let's see here. We'll delete that and go down. Okay, I suffered from severe sciatica, but by understanding the movements that had been causing my pain and using the simple tips and exercises, the condition improved so much that it's given me the confidence to know that I can now deal with the problem myself should it recur. This is exactly what I'm looking at. I'm not reading these things to brag. The reason I'm reading these things is because I want to show you that's from a book that I wrote, 7 years ago. And these people were able to solve their difficult pain themselves. And it proves to me when I hear stories like this, that I'm not making this up. It's real. It's real. You can solve your pain, and you can do it yourself given the right information. The problem is you haven't had the right information. It's not that you're broken. It's that you haven't had the right information. Because most practitioners are looking at things from this component standpoint. It's not big enough. The body is more complicated than that. Okay. You can do this too. And I've made it even easier and faster. So let me take that. Sorry, I'm jumping around here. Let's see if I can, we'll just stay here in this window. But over the years, I started writing my books back in 2009. So I've had lots of people contact me and ask me for more help. I've had Zoom sessions over these past 15 years. Being in my clinic for the last 10 years, I've started to see that there are patterns of issues that are going on that are common to almost everyone behind these issues. And it's the same movement habits. It's the same that create the same patterns that create the same pain. Now, the pain may be expressed differently from one person to another. Someone may have back pain where another has SI joint pain, but the same pattern is behind that issue. And so all of that, I've learned from all of that. And so that's allowed me to create, I just did it again. So let's take that away. I've created this digital download and a DVD program for back and sciatic pain based on this understanding of these patterns of dysfunction that almost everyone seems to have, and the knowledge of the biomechanics and everything that seemed to go into it. So even though it sounds like it must be so complicated, no, the beauty of it is I've been able to simplify this over the years to just a few different exercises that solve all of these patterns of issues. I've really boiled it down to make it so simple. So the real question is, does it work for everyone? Well, it works for just about everyone. Remember that small set of that flexion problem that I'm not even talking about tonight. It's not going to work for those people, but again, that's so rare. So we're going to find out if you're in that small subset right now. So what I'd like you to do, this is our second test. I'd like everyone to either lie down on the floor where you are, or lie down on your couch, or lie down on your bed, wherever you are, lie down, because this is an important thing for you to understand what the pattern is that's behind your pain right now. All right. We're going to understand this big pattern. So lie down on your back, and I want your legs to be straight. And because you can hear me talk, and you can hear my words, and you can hear that it makes sense. But if you don't feel what I'm talking about, it won't really have meaning to you. All right. So let's just make the effort to lie down on your back with your legs straight. So now, hopefully all of you are there. I want you to sense how much of your low back is off the floor? Is it off the floor? Is it touching the floor? Does it not feel so great in this position with your legs straight? Does it feel great in this position? All right, just feel, is there tension there? And now what I'd like you to do is bend your knees so your feet are flat on the floor. All right, now feel what your low back has just done with your knees bent. All right, most of you hopefully have found that with your knees bent, your back is now flatter against the floor. Simple as that. We're not looking for any miracles here. No, physics or anything like that going on. It's just a simple thing. Is your back flatter when your knees are bent versus when your legs are straight? It should be. Now, the second question then is, does your back feel better when it's flatter? And if you can't tell yet, then go ahead and hug your knees to your chest and see if that feels better than with your knees just bent on the floor. All right. Does that feel like a really nice stretch for your back, or does that really hurt your back? All right. And so what we're going to do now is compare this once more to your legs straight. So straighten your legs back out on the floor and feel that what has just happened to your low back arch. It should be arching a little bit more than when your knees were bent. Sense whether this feels generally good for you or bad for you as compared to when your knees are bent. So go ahead and bend your knees again. Hug your knees to your chest if that's what you prefer. And then just get a sense for whether this feels like a good thing for your back. Do you wish your back could feel like this all the time? All right, that's our test. So what are we looking at? You can come back to your screen again. So what are we looking at when we're doing this test? Well, what we're looking at is just what I talked about. It's a simple thing to see, does your back feel better when it's more arched, which is when your legs are straight? Or does your back feel better when it's flatter, when your knees are bent? And what I have found over the 25 years of doing this is that 99% of people feel that their back feels better when their knees are bent, when their back is flatter. All right. And there's many reasons for this happening. There are psychological reasons, there are biomechanical reasons, all sorts of things going on. But that's where most people fit. So if that fits your case, if that's kind of how your back felt, then you're in the right place. All right. So here's some other questions. All right. So we just did the first one. Does your back like it when your knees are bent when lying down on your back? If yes, if your back likes that, then yes, this program is correct for you. Does standing or walking increase your back or sciatic pain? Does your back feel better even temporarily when sitting versus standing? I know for me personally, I have an extension problem. If I stand for 15 minutes, I'm starting to look for a chair because I really want to sit down again because my back just doesn't like that extension. All right. Do you have have you been diagnosed with spinal stenosis or spondylolisthesis? Do you lock your knees straight when standing? You can figure that out right now if you want to stand up for the next 2 minutes and notice whether your knees are locking. If your knees are locking and you found that your back doesn't like it when it's arched, your knees locking is why your back is arching when you're standing, if that makes sense. Do you have pain on one side of your back more than the other? Do you have sciatic pain on one leg more than the other? Do you have SI joint pain? So where am I getting at with these last three questions? Pain on one side of your back more than the other, sciatic pain on one leg more than the other, SI joint pain is usually on one side more than the other. What am I talking about there? I'm getting at that side bending. That's a side bending pattern problem. All right. If you have back pain on one side of your back or sciatic pain or SI joint pain, if anything's on one side, likely you have this side bending problem that I showed you earlier. Okay. Oh, there I get it. Did it again. Okay. So here's what a side bending problem looks like in real people. All right. So if you want to know whether you have a side bending problem, it's so easy. Just take off your shirt, have someone take a picture of your back. All right, look at this. So here's what we're looking at. You see this deeper crease here than here? Here's a guy, big crease, no crease. Big crease, no crease. I mean, look, you can see how high that pelvis is compared to the other side. Big crease, no crease. Same here, big crease, and look at that pelvis, way up there. All right, big crease, no crease, big crease, no crease. All right. Now, I can guarantee you, just about everyone, if a practitioner sees this, they're going to say that you have a leg length discrepancy. And I would be really curious to know how many people on this call have been told that they have a leg length discrepancy. If you want to raise your hand, feel free to do that, because, and I mean, raise it, using the thing, because I can't see everyone here. Alan, I would be really curious to see how many people have been told that they have a leg length discrepancy. I'm telling you, it is not a leg length discrepancy that you have. Doesn't it look like it should be, though? When you see a pelvis that's way up higher than this, look at how high her pelvis is compared to this side. Doesn't it? It looks like it should be a leg length discrepancy, right? But that's not what's causing all of these problems. That's an assumption. The problem is that there's a mechanical issue in the leg that's causing the waist and pelvis to react to it. All right. So this is so easily corrected. I'm telling you, it's so simple. I can fix something like this in like 15 seconds. It's so easy. So, and then you can also keep it fixed for life. It's ridiculously easy because this pattern has everything to do with how you're walking and or how you're sitting. And if we fix those two things, we fix this pattern. All right. And this goes into how leg lengths are measured. I just had a woman this week who has been told for years she has a leg length discrepancy. I said, well, who measured you? She said, I don't think anyone ever measured me. All right. Well, what she had was a side bending problem. That was pretty clear. So we measured her leg lengths and they were identical. And so what a lot of practitioners, the way they measure, I'm going to get a little model to show you this. This is one of the biggest myths in medicine, is this leg length discrepancy issue. So I want you to be clear on this. All right, so let's see, I'm going to back up a little bit. So here's our model. All right, so what you're seeing is one side of the pelvis higher than the other. So that means that this leg must be longer than the other, right? But we're measuring that from the pelvis down to the foot. Well, if we do that, then we're measuring 1, 2, 3 joints. Well, there's so much that can happen at each joint level, rotations that occur that will affect the orientation of the whole leg. That means that you're going to be off on your leg length measurement if you decide to measure it at all. All right. Because if this pelvis becomes rotated forward, now you're measuring here instead of here to measure that leg length. So what I measure is from the top of the thigh bone to the bottom of the ankle bone. That means we're only dealing with one joint. And if you do that, you'll find, because this is the leg, right? So if you do that, you'll find I've probably in my last 25 years, I can count on one hand the number of true leg length discrepancies I've ever seen. The rest is all compensations due to functional just patterns of, walking, bending, sitting, all sorts of things. So I hope that clears up that for you, that you likely do not have a leg length discrepancy unless you've had some severe trauma as a kid, broken a bone, the epiphyseal plates have been disrupted or something like that. Okay. And in fact, I just had another woman come in. She just had hip replacement surgery summer of last year, hips way up, other hips way down. Everyone's telling her to put lifts in her shoe to lift that other hip up. No, her legs are identical lengths. It's just how she's been rehabbed. They haven't solved this side bending issue that has occurred in her. She's developed some asymmetries in how she uses her body, which are now expressed as a side bending problem, which then, and you can imagine something like this, sciatic pain, right? Compression, left side sciatic pain, left side SI joint pain, left side low back pain. So if you have unilateral pain somewhere in your back or butt or leg, take a picture of your back and see if you have a side bending problem. Okay. All right. Sorry I went on about that, but that's a real big myth that's out there. Okay. So secret 3, how to solve the 7 most common back and sciatic pain diagnoses. Well, what are they? Back pain, sciatic pain, stenosis, disc diagnoses like bulges or herniations, spondylolistheses, SI joint pain, unilateral back pain. Those are the 7 most common types of back pain diagnoses. Here's how we look at them. So when you look at the body from a system standpoint, from an extension problem, if all of you found that your backs felt better with your knees bent, Then you have an extension problem. You don't like it when your back is more arched. These are the types of diagnoses that come with that type of pattern. Stenosis, spondylolisthesis, low back pain, disc issues, facet pain. If your diagnosis includes these words, these are likely extension problem. It's really an extension problem you have. We fix this an extension problem. We don't fix stenosis. We don't fix spondylolisthesis. We don't fix disc issues or facet issues. We fix the extension problem, which then takes all of this pain away. All right. The stenosis is a change in the bony portion of your spine. I can't change that. Spondylolisthesis is a small fracture in a part of the spine that allows slippage of one vertebrae and another. I can't change that, but I can change the forces that are acting on those problems. I can change all the forces acting on the disc, the facets, all of that stuff, which then takes away pain. Because believe it or not, people have these diagnoses and have no pain at all. Side bending problem diagnoses. All right. Sciatica, SI joint pain, right or left low back pain, right or left facet joint issues, right or left disc issues. Likely a side bending problem that's feeding that. As a therapist, it would be so arduous to have a different way of treating sciatica than I have for treating SI joint pain, than I have for treating a facet joint, than I have for treating a disc issue. This makes it so much easier, right? I just have one treatment. I fix the side bending problem and all of this pain goes away. That's the beauty of a systems approach. Okay, how does it work? Well, all types of back pain have everything to do with how you're using your body. Doesn't that make intuitive sense? How you're using your body must have something to do with why you're having pain. All right. So if you can understand that, then how you're using your body then creates tight or weak muscles, which makes sense. If you sit all day in a chair, your hamstrings and hip flexors will become tight, right? Makes sense. Tight or weak muscles then create strain to tissues. And over time, that strain leads to tissue damage because the body is responding to the forces acting on it. So you can't get away with having all of this asymmetrical pull and stuff on your joints and not have any change in the body as a result of it. It's got to respond. That's what it's designed to do. All right. So the method, the Fix and You method, teaches you how to fix the hidden pain causing habits. They're hidden because do you think any of these people in this picture knew that they were walking around with a side bending problem? No. Their brains are telling them that they are level, because if their brains were telling them that they had a side bending problem, they would have solved it. But their brain has adapted to this and said, this is what normal is. The assumption is that normal is right, and it is not if you have chronic pain. All right. And so we teach you how to fix the hidden pain causing habits, which then helps fix the key tight and weak muscles and decreases strain to tissues, joints, reducing pain. It's really quite simple, which is how my therapist described it. It's so much simpler than what we're taught in PT school. All right. Here's a guy, Al, who had sciatic pain for 8 years. He had a laminectomy, a discectomy. He went through all of these people, 8 years, gone in 2 sessions. All right. How did we do that? No magic. We just understand things from a system. I saw immediately what the problem was, and it wasn't in his back. I can tell you this. It was in his back system. All right. So we fixed the system. We fixed the pain. All right. So there's a DVD with this. These are some happy people. I have some videos of these people over here are walking. We do a lot of observation of movement in my clinic, and I just wanted to show you some of that, but we're just going to kind of race through this. All right. But these people are happy, not because their pain is solved. Their pain is solved, but they're happy because they're in control. They understand why they were having pain finally. And now they're in control of their body. And that's what really makes people happy, is that, oh, I'm not broken. Oh, I can fix this. It's something new that most people aren't being told by a lot of people. All right. Instead, they're, being told they're broken, or, you have to have surgery to fix this or something like that. Okay. So if you go to fixbackpainwebinar.com, you can get this program for $47. It's pretty cheap. All right. The real question is this different from your previous practitioner's approaches? Have you been told things like this upslips, downslips, rotated vertebrae, all that kind of stuff. That's component thinking. All right. And for you practitioners who might be listening to me out there, if you go to healpatientsfaster.com, you can sign up because I've created an online course to teach you how to see the body and solve pain like this from this standpoint. And that's not just PTs, it's yoga instructors, personal trainers, Pilates instructors, PTs, chiropractors, massage therapists, anyone who works with the doctors, anyone who works with the body to solve pain or deals with movement should take this course, because you'll learn so much about movement and how movement creates and solves pain. So there's my little plug for that, healpatientsfaster.com. And so this is how I see the body again. All right. So you might be wondering, do you have time? No, it takes about 20, 30 minutes a day to get through the exercises to correct these things. There's a 60-day money back guarantee. There's all sorts of, I've created 5 different programs. So, you know, and they're from foot to head. So doesn't it make sense that if I really understood how the body worked as a system, I should be able to fix everything from head to foot? And so that's what my programs do, is they solve pain from head to toe. Now, because it's a systems approach, there's overlap. For instance, the hip is very close to the back. So there's lots of overlap between this. So if you end up getting a bundle, you get a big reduction in price because of this overlap between the back, the hip, the knee, the foot. All of that's part of the same system, but there are certain things that focus on one or the other. So if you have back pain, but you also, I do have knee pain and hip pain and foot pain, well, maybe you would get the bundle, maybe not, I don't know. But there is going to be overlap there. Okay, so here's how you get the free DVD. So for the first 7 people who go to www.fixbackpainwebinar.com and type in this code, and I'm going to show you how to do that in just a sec, BPW, Back Pain Webinar 472. You'll get if you order this, you'll get the free DVD. You don't have to pay for it. So we're going to do that right now. It's $47. It's a pretty good deal. So what I'm going to do is I'm going to go there now and show you how that looks. Okay. So when you go to Fix Back Pain Webinar, you come to here. Here's where you enter BPW 472. You click apply. And what you'll see is the price has been reduced. We've taken care of the shipping and handling. Instead of paying the 57, you'll pay 46. There may be taxes in your state that you have to apply, but basically that's what's going on. Okay, so let's go back to the other one. I'm going to stop sharing that window and go back to the other one. And then we can start off with questions. Share screen. Here we go. Okay. All right. Does anyone have any questions? Alan's going to help me read them because I can't see the chat. So if you have questions, let me add them.
Yeah, so we have 2 questions here, Rick. One of them is from Annie, and I'll unmute her in a second. She says, is your QL muscle the same as sciatica? So let me find her here. Annie is here. There she is.
Hi, Annie.
Hi there.
All right. I can't see you, but I can hear you.
Yeah.
All right. So let me go. I'm going to go get another model to show you the answer. I'll be right back.
Okay.
Okay. So here's the QL muscle, right?
Mm-hmm.
It starts at the hip and it inserts into all 5 lumbar vertebrae and it goes up to here. So that can contribute to back and sciatic pain on this side. But guess what? The real question is, why is the QL either tight or spasmed or whatever? That's the real issue. So the QL is remember how I showed that picture of the whole pelvis being higher and the ribcage being lower on that side?
Yes.
Well, the QL is one of the muscles that's holding all of that into place. It's locked there. All right. So we can solve that. That's happening because of a problem, usually with the same side leg, like I said. But just addressing the QL, I mean, there's many other muscles too. There's There's the internal and external obliques that run down here. There's the transversus abdominis. There's the latissimus dorsi. They all run down here too. The QL is just one small one, right? So what we need to do is fix that whole, and the issue is that most people don't know how to address the internal and external obliques or latissimus dorsi, all right? And so they focus on the QL as the problem. Because if you push on that little deep muscle, you might get a referral of sciatic pain in your leg. Is that what's happening with you?
No, but it bothers me a lot.
Okay.
So I think
My guess is,
I think I
would
have one of
someone-
those pictures up there.
What was that?
I think I have one of those pictures up there.
Oh, yeah. Oh,
Yeah.
of the people.
Yes.
Yeah. So that's what I was just going to say. Have someone take a picture, see if you've got a side bending problem. I bet you do. If that QL is bothering you. All right. So what is happening, this is going in a little bit more detail. I won't go into too much, but the better that you can weight bear on this leg, the more this QL will shut off.
Okay.
It's
So
kind of counterintuitive, but
weight
that's
bear
that's the way it works.
Okay. Weight bear on the
Alright.
side that the QL is bothering you.
Typically, that's what's going on. Sometimes
Okay.
it's a compensation from the other side, but usually it's the same side.
Okay. Thank you.
Yeah, I hope that helps. Thanks.
Yeah.
Okay, we also have Charmian. I'll read this and then I'll let her unmute. I have 10 years chronic shoulder pain. Pain is in muscles of shoulder, especially rhomboid, pecs, deltoids. The pain switches sides every few days. Can one of your programs help me, or should I do a Zoom appointment with you?
Yeah. And what was the name again? Alan?
Charmian, Charmian. Let me see if she's still here.
Charmian. All right.
Hi, yeah, I'm
Hi,
here.
Charmian.
Hi,
How are you?
I'm good.
Good.
Thank
So, yes, so if you remember, I'll scroll back to it. Here it is. See this Heal Your Headaches program?
Yeah,
My secret weapon to heal headaches is fixing the shoulder girdle system.
okay.
So do you also have neck pain or headaches?
I don't have headaches, and if I have neck pain, it's only when the shoulder pain grows up into my neck, like it's
There we
not
go.
isolated in the neck.
Yeah. So I think that would be the program for you.
Okay.
And I think, Alan, aren't we going to be having a neck pain and headaches webinar sometime in the next few weeks?
I believe it's going to be in the next 2 weeks or so.
2 weeks. So, if you want, you should dial in, because I'm going to explain why that causes neck pain and headaches and what we typically do to solve that kind of stuff.
Okay, yeah.
But
'Cause
anyway,
I have
it's
your shoulder pain book, and I just got the neck and headache pain book like the other day, because something I read of yours said that's where I should be directed to for shoulder pain. And I'm just a little like, I feel like I don't know which exercises I should focus on.
Yes. And I'm sorry for that. And that's exactly why I made these downloadable programs, because I wrote those like 12 years ago. And so I didn't want to take anyone down a specific course, because there's so many different courses that people are coming from. So I couldn't say you have to do this, because, well, person B doesn't have to do that, right? So I just put the exercises in there that will solve just about everything, but it's too broad based. And that's why I created these programs. And also I've seen the patterns. So the Heal Your Headaches program has all the information. Then I think if you look at the two books closely, you'll see the exercises are very similar. How I solve shoulder issues is the same way that I solve the neck issues. So what I would do maybe is find the common exercises and do those. And there's
Okay.
going to be maybe 4 or 5.
Okay.
Yeah,
Okay,
it shouldn't
great.
be that long. Yeah, but here's the thing that is missing from those books also, is that I have developed some really powerful taping techniques to help the shoulder system work better, faster. And they help you see how you would feel if the shoulder system was working perfectly. And so that's what we use in my clinic. And it really works really well. But anyway, those aren't in the books. They're in the downloadable program, but try the books thing first and see where you get with that. I've just done it much better in my program now. And that's why, for that reason. So,
Okay, great.
But you're right. Yeah, it is the shoulder that is the problem, but the neck and the shoulder book will be very similar. And, you'll see that when you read them and you look at the exercises, do the common ones.
Okay, thank you so much.
All right. Thanks for being there.
All right, Rick, that's all the questions we have for now. I mean, if someone else does have a question, they should certainly ask it because we're still here.
Okay. Well, if no one has any questions, then we can sign off, I think.
Okay, somebody's raising their hand. Looks like David is raising his hand.
Oh, okay.
David, you can speak. I think you're unmuted.
David?
Hands up. Don't hear him speaking yet. Maybe his mic is trying to get together. I don't know.
And David, if you have a question, you can also type it in the chat if you find that something's going on with your mic or video.
All right, so aside from David, does anyone else have a question?
Okay, everyone. Well, thank you for joining me.
Rory is asking, will the recording of this session be sent to us? Absolutely. Yes, I will make sure.
Yep. That'll come out, what, Alan, a couple days?
Couple days, yeah.
Yeah.
Someone asked, do we have a knee pain seminar coming up? Yes. So what we're going to do is we're going to be separating these every 2 weeks or so. And we've got something special coming up next week that because you're here, we'll just tell you about it briefly. Next week, we're going to have a PT Q&A day. So no matter what part of the body you have a problem with, we're specifically answering questions for 60 minutes next Thursday. You're hearing about it here first. That's what's going to happen next Thursday.
All right, everyone. Well, if there are no other questions, we will sign off. And thank you, everyone, for joining us. And I wish you well. Have a good night.